So good afternoon, Tewksbury. It is 1:04 p.m. on Tuesday, April 21st, 2020. I'd like to call this COVID-19 emergency operations update for the Tewksbury Board of Health to order. Director Soar, I'll turn it over to you to give us an update.
Sorry, I had to get the governor off. I had the governor on. I was listening to him. Apologize. Good afternoon, everybody.
Hi, Susan.
Hi.
Hi, Susan.
You guys are quiet today.
Hi, Susan.
Here's the one window.
You should do a roll call on who's here. Who's here on the board?
Maria Zaroulis is here.
Robert Scarano is here.
Tony Bichetti is here.
Ray Barry is here. 5 members here.
Great. Thank you, everybody. I feel like I just saw you, so it was only a few days ago. Hope everybody had a good weekend. It's been busy, as you can imagine. There's a lot of new stuff on the state's website. They have a dashboard that has, 23, 24, whatever pages or more. I encourage everyone, board and everyone else, go to the state's dashboard. They're doing a lot more breaking down of, now that they're talking about the cases and the numbers, they're doing a lot more breaking down there. There's a lot more information on long-term care facilities, guidance for us. It's just a lot going on. Irvi Agawala is going to try and join us. She had to make an important call right now. She said she'd be on as soon as possible. But she just got off a 90-minute call with the state with Maven. So more than likely is going to hear the same thing. I have a call this afternoon with, it's actually a WebEx on the Community Tracing Collaborative and how they're going to be helping us starting hopefully tomorrow, although we actually had already started as a pilot, but I think this is going to be more for the rest of the state too. But the Community Collaborative Community Tracing Collaborative, CTC, you can go on the website too and learn more about them with the Partners in Health if you Googled that. So we haven't learned how it's all going to work yet, but basically what I've been told is communities that choose, when you get a new case, you can choose for someone to help from the collaborative, or if it's a case, say, we want to keep, say it's a part of a group or a group home or something like that, we can keep it ourselves. Otherwise, all cases hopefully will be caught up very soon if they're not. Well, should be getting there now. But it's a big thing that the state wanted to do this for all the cases, so it's their baby. So they made something that was impossible for the locals to keep up. So there's, all their data that they're asking for. So I'm glad they're going to be doing that. So that'll be our big change this week, I hope. Don't really have an agenda. Like I said, it's just been really busy. The office is getting calls, some from employees, some from employers, asking questions, not to mention families of people in long-term care facilities, a lot of questions about that. There is a family resource line that the governor just mentioned again, 617-660-5399. I guess it's getting a lot of hits. Family resource line, 617-660-5399. So I think these are families of people in elder facilities. But I haven't called it myself. I don't know, but I guess it's getting a lot of traffic.
Did we get any feedback, Susan, on what's going on with Tewksbury State Hospital and their lack of communications to us, as we discussed? I know we're sending a lot of resources out there, the fire department, especially. I'm not sure what's going on with the police, and I know you were going to check into that. I didn't get to hear back from you, so I'm just curious as to where we are right now with that from the perspective of what what they've said, because I feel that if they're going to be part of Tewksbury, then they should keep us in the loop, not after the fact. Unfortunately, after I did speak with you, I had a few other people call me that that they're hearing that even people at the Tewksbury State Hospital are upset about what's going on with their lack of communication and their last minute time. So my concern was if the state is going to be leaving us out of the loop, even though the state hospital's in the town of Tewksbury, yet they want our resources, which put the rest of the people in our community at risk, and also who's going to be paying for it every time we access that. I mean, they're either part of the team or they're not part of the team. And I know from your email you said the communication was poor. I was wondering if you had a chance to talk to Chief Hazel and find out, you know, how many times they've been up there and what the status is, because word around town from people is a lot of people have having, basically what I'm hearing is people were dropping like flies. That's what people have been telling me.
So yeah, as you know, so Tony had called me yesterday. So I did reach out to Richard and Chief Hazel. My specific questions, you know, my concern was looking at, they have like 9 different programs there. And I was curious about the communication between those programs and the state hospital main management. So I asked him about that. So he was getting me some information on that. Want to make sure we have all the lines of communication up for those, for all those different different programs. And then yeah, we were talking, you know, we were going to have a phone call this morning. We couldn't fit it in with all these phone calls with Irby and you know, chief and town manager and I to go over what we did, what they've been looking into for me since I put that out. So as far as like numbers, things like that, no, I absolutely do know they go out there. They always do. And hopefully financially wise, I mean, they might have something going on, but that's not with that's not through our department. But yeah.
No, my concern,
public health question. Yeah. Yep.
As I said, my concerns were that, you know, if the state wants to make Tewksbury State Hospital be an island unto themselves, then that's one thing. But because they are in Tewksbury, I mean, I think that, you know, as you said, there was poor communications. I'm wondering, you know, who would we contact to improve communications? Because even from what I heard, even the director of the facility was a little blindsided. I mean, I'm getting calls from a lot of people that have information sources within the hospital. So I'm just hoping, like I said, if they want to be.
It's not a lot of those questions wouldn't be coming to me. You might want to redirect them if it has to do with emergency response and everything. Would be more, you know, Chief Hazel and you know, town manager is the emergency management director. But yeah, no, we are going to have more conversations about it. The conversation has been opened. It just is in the beginning stages since I talked to you yesterday. So
well, I know that's why I said I didn't see that. That's why I had asked, and you haven't had a chance to talk to them. I didn't see the point of having multiple people calling Chief Hazel and Richard with all the
yeah, I did pass it on. Yeah,
doing so.
Yeah,
Yeah,
I think I got your,
okay. Well then.
Yeah, I think I got your
my drift.
message across. I hope. Yeah. Definitely.
Yeah, that's fine, Susan. No, that's okay. They just haven't had a chance to do it. And like I said, because I think some people were ready to, you know, want to write the governor and find out what's going on, because, I mean, they're either with us or they're not with us.
Yeah, the
So
state
that's
rep
fine.
might be involved too. You never know. Yeah.
Yeah, I guess we could contact, I guess we could contact David. Have you been in touch with him? Has he been in contact with you for anything, David?
Me personally, no. Did Ray?
Okay,
Did you
I
say
don't know
something
if
about
he's, I don't
David?
know if maybe Richard, yeah.
What did I read about
Yeah, I did,
being involved? I can't remember. Maybe that was on the patch. I don't know.
Yeah.
But go ahead.
No, that's okay. I mean, like I said, I was just trying to keep the extraneous calls to a minimum from all these people that are probably inundated with calls. I know you're inundated with a lot of calls as well. So, I mean, I know that was a concern. And then,
I'm also
like I said,
concerned,
people
obviously,
would say,
about the
well,
public health everybody. So, yeah.
Yeah, and I think people were concerned that sending our first responders to a facility
Mhm. Oh, yeah.
that's not communicating with us, and they're putting, other people in our community in jeopardy and jeopardizing the
Yeah.
first responders. I mean, I don't know what the status of PPE is within the first responders that we have, but I
That's
just know that
that's
a
a
lot
good
of people are having a
conversation
hard
to
time.
have. Yeah. Yeah. That's a good conversation
Yeah,
to have.
no, I'm just saying I mean, like I said, if they're part of us, then they should be sharing stuff with
Mhm.
us. But my understanding after our last call last week was that they're going to handle it themselves. And when someone tells me they're going to handle it themselves, I'm assuming that they don't need our help. And but it
Mhm.
sounds like there's a lot of overlap. So I think if we're going to be overlapping as a community, then we should be kept up to date what's going on there. I mean, you can't have it both ways, the way I look at it. So. That's all I had to say on that, and then see what the other members of the team have to say. We'll wait to hear from Richard, and we'll wait to hear from Chief Hazel, and hopefully they'll contact you first, and we can reflect it. Because, like I said, I can't see 10
Yeah, we have a
people
planned
calling.
conversation. Yeah. We will.
That's great. Thank you.
You're welcome.
I'm here.
Who's
Sorry, I
here?
was a few minutes late.
Oh, hi, Irvi.
Hi, sorry, I was
Hi,
on
Irvi.
a call. Can you hear me?
You're quiet, but I can hear you. Everybody hear Irvi?
Yes, thank you.
So, Irvi, I mentioned a little bit about the collaborative coming online and that we're going to be learning a lot more about it today. You probably heard a lot on your Maven call, not in too much detail, but how'd that 90-minute call go? Go well?
Yeah, it went well. I think that the 3 o'clock call is definitely more geared towards the community tracing collaborative.
Mhm.
The 11 o'clock call was a lot of kind of the same stuff, but they talked a little bit more about long-term care facilities, and they talked a little bit more about healthcare workers, which I have to actually go back and review because my internet went out right as we were talking about that. But I can go back and review it. But so, yeah, so I'm actually really looking forward to the 3 o'clock call. Susan, I didn't even really get to tell you, but there's definitely gaps in the communication between, and I had mentioned this last week as well, or on Thursday. There's definitely gaps between the community tracing collaborative and us in the sense that when they get assigned, like when we ask for help on a case, we don't know if it's going to the academic public health volunteer corps or whether it's going to the community tracing collaborative, which is Partners in Health.
Yeah.
And so I actually spent a lot of my morning trying to figure out what was going on because there was no updates on a bunch of cases I could ask for help on.
Yeah.
Come to find out that the Academic Public Health Volunteer Corps, the data doesn't get transferred into Maven until they complete the case. And so I had nothing to go on. Luckily, I was able to confirm that those were the Maven numbers that they were working on, and that they hadn't gotten lost somewhere in cyberspace. So like I said, and I believe that this week is the last week that they're going to be using the Public Health Volunteer Corps. They're going to switch over to the Community Tracing Collaborative, which I think will be nice because I think at this point there's just too many people in the mix.
Mhm.
And so yeah, I'm looking forward to what they have to say.
Good.
Hoping that the communication will be better going forward.
No, that's great. We're looking forward to that too. Those gaps were definitely, we were worried about those.
The other thing that I need to figure out, I'm sure everybody is wondering like what these numbers are. I've just realized, so what happens is when you close out a case in Maven, so like say for example, you had a case, you followed them from the beginning, you close them out because they've recovered and you sign off on the case. That was what I was basing the recovered numbers on. But that has changed a little bit because now when you ask for assistance, you also close out the case. So I have to weed through which ones are actually recovered and which ones have been handed over to either CTC or the Public Health Volunteer Corps. And that's just really a lot of manual going back and forth between Maven ID and, my spreadsheet and Maven to kind of figure out. Some of them I know, if the person has recovered or not. But some of them, that the other nurses have handled, I may not necessarily know, have they recovered. So that's kind of what I've been trying to work on today, but it's been one call after another.
Tuesday of phone calls, I know.
Yeah.
No.
So,
Phone hasn't stopped ringing here either.
I'm sure.
Now that'll be good to get that all straight. That chaos is not something that's I know not good. It doesn't sit well with you. I know.
No, it does not. I don't like it.
No,
It
you
keeps
don't.
me up at night.
Yes. Yeah. Well, thank you for doing all you do. I hope you did get some hours off this weekend.
I was off on Saturday.
Yeah.
A little bit. Yeah, that's good. Yeah. Does anybody have any questions for me? I'm sorry, I don't know what you guys already went over at the beginning.
Not much. I just, we were saying that we were going to have more conversations with the Tewksbury Hospital, so that we'll do that afterwards. And I just gave them a little overview of the CTC. That was it.
Okay.
Were the other members aware of that? I'm sorry, Irvi. I'm sorry, Susan. Was the chairman and Maria and Bob
What?
and Charlie aware of that? The other stuff, like I said, I'm not sure if you had a chance to speak to the other Susan about that. I just wanted to make sure they were aware of that, what was going on with the Tewksbury State Hospital as well.
No, you described it very well. I think they caught on pretty quick. No, I didn't inform them of the other members of anything because it was still in the investigation.
I wasn't sure I was checking in. Yeah. Okay.
Yeah. No, you explained it really well.
Thank you.
Yeah.
That's the other piece of the numbers is I also Tewksbury Hospital cases and the assisted living facility cases. You also just pretty much close those out because the hospital is following the hospital patients and the nursing homes are pretty much following the nursing home patients. Otherwise, unless I get some other information, in terms of symptoms or whatever, I can fill that in. But I'm also required, not required, but I'm closing those cases out because Maven was not designed to handle this volume of cases. So they really want us to, in order to keep our workflow moving, they really want us to close out the cases that either we've requested help for or are like an inpatient at a hospital or at an assisted living facility. So those numbers are also mixed in with the completed cases. So I can't guarantee that. So I really have to just look through basically all the cases that we've had that have been completed and figure out which ones are actually resolved and which ones are like living or nursing home and which ones are the hospital. Unfortunately, right now, the way that the report is run, it doesn't differentiate that for me. So it's just, I have to go in and manually do it.
Irvi, one question. When you said the hospital, has the state, my biggest concern was, and Susan has said that in the email, the hospital was giving us poor communications. So some of those numbers that you're getting, are they coming from the hospital? Because my assumption would have been that they weren't relating that information to us unless I'm wrong. Because I know they're using our services, but I didn't know whether they were relaying the information because it didn't appear that communication was good on our end. But I don't know, were you in good communication with the, I'm not sure whether, who the person you'd be dealing with at Tewksbury State Hospital when you said you weren't sure how those numbers broke down. But
yeah, so my point of contact is the infection preventative. Her name is Claire Mundry, and I have to say no. I think that they are in the middle of being very short staffed. They're in the middle of an outbreak. I think they're really just trying to, um,
My, yeah, my understanding is they're a little bit disorganized. They don't have all the information, but yet they're in the town of Tewksbury. So, I mean, that's what I'm hearing, and I hate to say it, but I'm hearing it from people that work within the hospital that contacted me, and
Okay.
I wasn't sure. So, those numbers, but the numbers that you have reflect, at least as best as they could give you, Tewksbury State Hospital as well for our community. Is that what
Right.
my understanding is?
Yes, they do include the Tewksbury State Hospital patients. And they're not
Okay, so they
reporting.
could be, the numbers could be even more severe than that without reflecting it in the numbers at this point.
What do
or
you mean,
less,
the
I guess.
hospital numbers or our town numbers?
Well, I mean, that if the hospital numbers are being included with the town numbers,
Mhm.
I'm saying that and where there appears to be short-staffed and lack of, a little bit more disorganized than they would probably like to be. So some of those numbers, they could be off either way, either higher numbers or less numbers in the hospital. Is that a reasonable assumption?
So, the information that I have is that, and now this is not all the hospital patients. This number that I'm about to say to you also includes some employees. Is somewhere around 60 that I'm aware of. All the residents, as I understand it, we do have, I would say, 45 of the Tewksbury State Hospital residents that are included in our numbers. But they're not draining any resources in terms of my hours because, like I said, if I see that they're a Tewksbury Hospital patient, I go ahead and sign off on them because I know they're being followed in the hospital. I do understand.
No. It wasn't. Yeah, I wasn't worried about the resources they're finding it. I mean, basically, what people that have been contacting me were saying, people were dropping like flies at the hospital. So that could be hyperbole. That could be a lot of different things. No, I wasn't worried about the resources for you. I know you're busy for what you're doing. No, it was more you were not involved in that conversation. You came in a little late. My concern was the fire department was going there quite a bit, and that impacts our resources. Like I said, my big thing is the Tewksbury Hospital with us, or are they want to be independent? And from when we had our meeting last week, it appeared from what we had heard that the hospital wanted to be independent of us at the time. So that's why I'm just trying to get a little bit of.
I think that the hospital is just going through a big cluster of their own, and I think that they're just trying to survive at this point. But to your point, they did not communicate really much with me until I had reached out to Claire Mundry. Like I said, she's the nurse there that's in charge of the infection control. And the numbers that I get are not from the hospital. They're from Maven. So they're from the state health department. They're not from the Tewksbury Hospital. There is an epidemiologist that is working with them, with the hospital, to make sure that they have the supplies that they need and the staffing that they need. But I think at this point, they're just trying to stay afloat. And so maybe that's why the communication has been lost a little between us. I'm not sure. I don't know what the relationship has been like in the past.
Well, that's okay, Irvy. I know you're doing yeoman's work with what you're doing for our community. Like I said, my concern was they're either working with us or they're not. So you're getting numbers from the state. So those numbers may or may not be accurate because, like I said, from what I am hearing from people that have contacted to me and reached out to me that know people within working, unfortunately, everyone's, they hear things. It may be exaggerated, it may be not exaggerated, but that's how you're getting your numbers. So, okay, that's fine. I'm fine with that. So I understand. I totally understand. So I just appreciate everything
numbers,
you're doing.
My numbers are from, not from the hospital.
from the state. Yeah, I hope the state communicates better with us because the hospital still is in Tewksbury. So, you know, like I said, they either work with us, they can't have, I know they're short staffed, but it's nice to be on the same page with them. And so you're getting it secondhand information, third hand. So, okay, that's fine. That clears it up for me, at least at this stage of the game. So we hear more. We may have to talk with the governor about that afterwards. But that's
Yeah.
something we'll leave with the town manager.
That's a good point, because if something like this happens again, you know, we really need to know what is our responsibility to the hospital, or what is their responsibility to us, you know, because they are using our resources in terms of transporting people to the emergency room if people need to be transported or.
Correct. And I mean, not only the transportation, but I worry about, I mean, when you read all the studies, and correct me if I'm saying anything that's inaccurate, but it's the frequency and the contact of normal, healthy people that are coming in contact with, you know, COVID-19 people, the virus, and the more frequency people are having, the more extended time they're having, the more susceptible they are to catching it, even if they recover safely. And that just puts our first responders that are basically there for the community of Tewksbury at risk. I don't know how often the police are going down there, but I mean, I know the hospital has its own police department, and I know that at one time they had their own fire department. So as I said, I think they just should be more forthcoming. I mean, I'm not one that suffers excuses really good. I mean, I'm surprised with the state doing everything. They should have enough people to cover it. I know they called in the Army Corps of Engineers to come and help them. And like I said, I just think they should be more forthcoming with their collaborators that are trying to help, because we're all in this together. It reminds me of what's going on with the World Health Organization. You know, someone's saying one thing and you get distorted information from the other. But that's all right. I think I've made my point. I just appreciate everything that you're doing, and I commend you for all your hard work and keeping us informed. So thank you. Does anyone else from the board and my colleagues have any insight or any additional recommendations or thoughts on that, or am I the only one that feels this way?
Well, I certainly have concerns about utilizing resources, but at this point, I don't know exactly what you could do to minimize that, other than I think the governor has looked at supplementing with National Guard and other folks up there, but certainly they're within their own jurisdiction, and I know that it's always been the policy of the town to respond where Tewksbury Hospital has a need, just due to proximity. But certainly Tony raises some good points where they can be overwhelmed easily. They may not be able to respond to a local need if they're absorbed by state needs.
No, thank you, Bob. I'm all ahead. I just want to know, you know, our resources get depleted or people become sick. I mean, it's like I just think the communication should be better. And realistically, with the state, I mean, the state has more resources than the community of Tewksbury or some of the others. So I find it just interesting that they're short-staffed. They're all here, and it may be that. Like I said, the word around town is that people are dropping like flies at the hospital. So we're on the same page, I believe. So thank you for that. I just like to know who's going to, you know, we're more than happy to help out and be part of it. And I do get it. But like I said, from that last email when that question was brought up a week or so ago, or when we discussed it at a meeting, we said, is Tewksbury Hospital going to be part? And they said, nope, they want to take care of it. So I'm okay with that. But I think that when all said and done, we'll have to sit and maybe address some of these for hopefully never happen again. But it's I'm pretty amazed that the hospital is as short-staffed as everybody's saying right now. Because even though they're short-staffed and everything, I still think that communications is vital. So I'm really not one for excuses. Doesn't take much to contact someone and let them know, because they sure as heck can contact the state. But the state, I don't feel, is being as reciprocal with giving us the information, maybe in real time. But for what it's worth, just as my opinion. But thank you. Did I lose everybody?
I was thinking the same thing.
I think this is one of those things to think about, going forward in terms of, like if something like this does happen again, how we should have a plan in place. So something to think about going forward.
Well, I appreciate it. We've had enough emergencies over the years. I would have assumed that the state might have had some things in place, but it looks like it's clearly evident, like New York was unprepared for stuff from their governor. It looks like maybe our governor was unprepared as well. So from a state standpoint. But it's interesting. Like I said, my primary concerns is the community of Tewksbury right now. So thank you.
Well, I guess just one point to bring up our question for the director and for Irving. In my understanding, one only needs to call 911 if they're suffering respiratory distress or any other severe symptoms of COVID. And like anywhere else, if someone has minor symptoms, they're essentially self-quarantining, or in the case of the state hospital, they're just putting those patients up on floors that they've dedicated to keeping care of the COVID patients. And just like with any other 911 call, the dispatchers go through a COVID screening questionnaire to determine if the patient or potential patient is potentially exhibiting COVID symptoms.
Yeah, I think you're right. It is, the patients that are, that obviously emergently transported because they're under respiratory distress. I'm not sure if that's actually what's happening. I don't know if people are going in, being transported because they have a really high fever, because I am finding that some people do spike with really high temperatures. So I don't know if our fire department is being called for respiratory distress type of symptoms, or if they're being dispatched for or called for like a really high spike in a fever. I know, like in terms of like regular residents, they're supposed to go like in their own car. Obviously don't call a taxi or don't call Uber. Go in your own car. And if you're having respiratory distress or other cardiac issue or whatever, call 911. And that's what I've been advising people as well. Like I said, in terms of the hospital, I don't know if they have some other way of transporting people that may not be under respiratory distress, that just have maybe like high fevers. I'm not sure. That would be a question, I guess, for the fire chief maybe.
And Irving, what about the Bowie Health? Is that just for general people calling? They're supposed to have the state contracted with Bowie to, help people decide, if their symptoms were. I don't know anyone who's actually made that call to Bowie to see.
I'm not sure either.
Yeah.
So I do know of the program. It's I believe it's a website, or it's a call number or a website that you can go to, and it basically triages you. I think it's a website, and you answer their questions. How you answer the questions, it'll ask you like a set of other questions, and it's try to narrow down. Yes, you need medical care, or you call your doctor, or you go to the emergency room, versus maybe this is something else. I haven't actually played with it. Maybe it wouldn't be a bad idea to play with it and see like exactly what the questions are and how it works.
I used it. I tried it out to see. Yeah, I did. I wanted to see, what it would do. And you can use it for yourself or for another person. So it asks questions like, you know, is this for you or for somebody else, et cetera. You know, it asks if you're male or female, your age. And it does go through a list of symptoms, and it asks you, like, do you feel this? And you, as you answer, it brings you to something else. And in the end, it will say, yes, you need to seek medical help, or it'll say, watch your symptoms for a few more days and see if they change. It's, you know, it's pretty general, but I think it would be helpful for someone who, you know, maybe has the sniffles, maybe a little bit of a cough, and they're worried it's probably allergies, but it could be something else. I mean, I think, you know, if you're starting to have respiratory problems that are beyond allergies, I think you would probably know you need to call a doctor. But, you know, it's I think a good app or website to go to for the average person that maybe is a little nervous and needs to put their mind at ease.
Mhm.
I think it's probably better suited for that.
Okay,
Yeah,
good to know.
yeah.
Any other or anything else to talk about the help systems at all? On the same line. I think one thing we did go on the CVS sign up site just for fun to see if we could get an appointment to get tested, and it actually is very similar to what you just described as Buoy,
Mhm.
and it just talks you. It doesn't ask your name or anything; it just talks you through your symptoms, and if it thinks and it asks you if first responder or if you're a
Mhm.
nurse, and then it basically says go to the next page and set up an appointment to get a test.
That's
And
it.
if there's one available, it lets you. And I guess if they have other questions, they're going to ask you. But ours actually would have set us up for a test, but there was no time available. So I guess it's
Oh.
that easy. I guess it's that easy. I don't know.
Huh. Well, I think the bigger concern now, though, are the people that are asymptomatic. They don't have any symptoms to put into any of these sites to find out. I don't have any answer for that. But
Yep, that's the whole thing. Yeah.
yeah,
Just assume stay 6 feet apart.
Right. If you stay 6 feet away from people, if you're practicing the physical distancing and you're washing your hands and everything, I mean, asymptomatic. I mean, this continues to show that there are probably more people that have had this, so it's not as the models that they had were inaccurate from the beginning, and it just shows that a lot more people have had this for a while, or they're getting it, and as the statistics show, about 85% of the population will recover from this. So,
Well, thank goodness for that.
but that's like in any issue. That's like in any virus, realistically, that's gone on, or any kind of thing. I mean, you're going to get some people whose immune systems are much better. I will be curious when all is said and done, when some statistics can be put on exactly what kind of comorbidities people have had with this, because they're finding that the virus has some unique characteristics where it can cause some damage to the blood vessels. I'm sure some of you folks are aware of it. It can cause some damage to some organ systems that, after the fact, by the stresses put on it. So it'll be interesting to see the numbers and the statistics of where the comorbidities, the main concern where most of the people had succumbed to the virus, because the other thing is the volume and the constant exposure of healthcare workers. I don't know for a fact, and I haven't heard, maybe some of you others, I was wondering if there have been any healthcare workers that had succumbed to the virus, as, and just anyone's heard. I haven't heard anything directly about healthcare workers. I've heard of other, younger people and whatever, but I don't think that they've been able to evaluate the comorbidities. I haven't heard of any really, really healthy people. Like I said, it's a big world. So, but has anyone heard of any really healthy people that have succumbed to the virus at this stage? Because like I said, asymptomatic is, you're never going to know. So we just have to hope that most people that have it, their immune systems are able to tolerate this.
So I haven't heard of any healthy people that have succumbed. I mean, I'm sure that there are cases, none that I'm familiar with, but I do know that there have been healthy young people
Exactly. Yeah.
in town that have gotten very sick, and their entire family has gotten very.
Uh-huh. But they've are they in that recovery phase? The recovered part, Irby, is that, I mean, like I said, I've heard people getting very sick of it, and tired. I mean, I'm sure it's a very nasty virus, but yeah. So I bet, social distancing is be very important. Protocols that have been in place that you can look up online, like we have, are the best we can do. But I don't think we're ever going to be able to address the people that are totally asymptomatic at this stage of the game, because it's like any other virus that's contagious. This one being more so, but it's contagious. But until we can test everybody, it's going to be really hard to know anything. To put the numbers in place. So, but I'm glad to hear you haven't heard of anybody. I've heard of people getting really sick that are healthy, but I haven't heard of anyone that succumbed to the illness that have been hit. So it appears as if it's primarily dealing with the comorbidities and exacerbating some of those, at least from what I'm reading and I'm seeing and I'm hearing. So I'm glad no one else has heard of anything yet. But as you said, I'm sure there are some people that have the virus has just overwhelmed a healthy immune system.
Sure. I don't have any comment on that. Anybody else? I don't have any examples.
Yeah.
So seeing it's coming up at 1:46, any other final comments or questions? We adjourn today, and we will have a follow-up meeting next Tuesday at 1 o'clock.
I do have one more thing, Mr. Chairman. This is interesting because I saw it. It came from the CDC, and I hate to go back to a topic that we've all dealt with and we thought was all put to bed. But Susan, have you had more people filing for permits for chickens during this pandemic? Because
the spring's been very slow. We may have had one come in the last few weeks, but not this spring now.
Okay, the only reason I bring that up is in my research and in my readings, I saw something about because most people are trying to, if their governors let them go buy seeds for growing product or whatever, a lot more people are trying to get chickens to raise the chickens so they can get eggs. And they were talking from the CDC about an increase in some of the zoonotic diseases coming from chicken eggs. So I just thought I'd bring it up because I can see people want to raise their own chickens and have more eggs with all the stuff that's been going on lately. So I just wanted to ask if you've noticed an increase of that, because it segued off of the COVID-19. If you folks want to check on the CDC guidelines and look about backyard chicken raising, they had concerns from the CDC as well about issues that can arise and problems that can arise with that. So that's just an aside. Other than that, I have nothing else to say.
We see a trend, I'll let you know.
No, thank you. It was just, I didn't think chickens would come back in the foreground again, but they could. But thank you.
Okay, anyone else have anything else you want to bring up today?
Nope.
Okay, so I'd like to make a motion to adjourn today's meeting then.
I'll make a motion to adjourn.
Okay, so I'd like to second.
I will second that.
Okay, motion's been put forth by Mr. Scarano and seconded by Mr. Rules to adjourn today's meeting. All those in favor will have you signify by saying yes by roll call vote. So, Mr. Rules,
Aye.
Robert Scarano, yay.
Dr. Bichetti?
Aye.
Okay, chair votes aye as well, so motion carries unanimously 4-0. So it is 1:49 PM. Good afternoon, Tewksbury, and we will again have our follow-up meeting next Tuesday at 1 o'clock. So thank you all.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye-bye.